Hi, I'm Suzanne Grimshaw. I'm the programme lead for Our Manchester, based at Manchester City Council.
My name is Paul Mattis. I'm the Community Development Manager for Big Life Centres.
So I'm Fran Speakman. I'm from ABL Health.
Hi, my name's Jo Martin. I'm a team manager from the primary assessment team for Central Locality.
Hi, I'm Dr. Shahid Munshi. I'm a GP. I work for a new care model called the High Impact Primary Care Team.
I'm Verna Davis and I'm the service manager at the Manchester Sickle Cell Thalassemia Service.
I'm Sophie Perry. I'm a wellbeing coach for the You First service, part of the Big Life group.
An asset-based approach very much underpins the Our Manchester way of working, and so it's really important to get an understanding of what an asset-based approach looks like in terms of a place-based council role, but also what it means across health and social care integration, particularly as that brings together the council and the NHS.
I first joined the course because I was interested in the person-centred care and asset-based approaches, because that's what we like to do with weight management. We like to find out why people are struggling with their weight and want to be healthier, but also bring out that from them to help themselves so that we can be more sustainable. As a company, we are really person-centred in asking a lot of questions, but I think it was learning new models that and getting a qualification in the stuff that we say we do and making sure we're doing it well.
I thought it might challenge some of my practice, take it to a more improved level. So these are the main reasons why I joined the course.
And what I've learned is the importance of language and how we ask those questions when we're carrying out our assessments.
So what I've learned from the experience, I think we all believe that we're delivering asset-based approaches in terms of the way that we deliver. I think the course itself does challenge that.
We have learnt I've certainly learnt a number of skills, but in particular I think the effective one for me was the TICRO model, and I've actually utilised that with members of staff, for instance, and it's been amazing.
The coaching T-Grow model and the coaching Diamond model have been really useful, and they've both given me a lot more structure in the way that I work with my participants.
Actually, this is about broader skills development, and it's really helped me to rethink my approach, not just about having a conversation, strength-based conversation, asset-based conversation, but really my whole approach to the way in which I think about what an Our Manchester approach looks like.
You know, having been a trainer, I've known about patient-centred care, but this is a slightly different approach in terms of how I approach the actual consultation, and because it's a longer consultation, we have an hour, which is just a luxury.
What has kind of shone through is trying to turn the negative questions into a positive question in order to kind of break down the barriers and to allow the citizens and those people who are involved with that care planning to be able to see the vision and to get to where we need to get to.
Even though I've been a GP for more than 20 years, you're always learning. It's lifelong learning. So this is a new concept to me, which is surprising, because you would think after that many years I should be seasoned.
It gave us almost a paper document and something to work towards, where with motivational interviewing it's more about learning the technique, where this gave us something that we could actually document and be able to put into someone's personal development plans. I use it in my management technique with my team of 10, but I also use it with clients and families, and it gives them a document to be able to walk away with.
The results are just absolutely amazing. In terms of their self-confidence, in terms of self-management, they've just come on leaps and bounds. And so I've actually even gone as far as securing additional funding to expand that programme.
So I've used the Diamond coaching model with a lady that wanted to start cooking for herself and cooking healthy meals for herself at home, and what using that model did was help her to think of lots of different options that she had to make that change, and then she went forward and set some goals using those options that she generated in the coaching session.
I was just amazed at the inner resource that was there that just seemed to have come alive. You know, they've taken there's one particular individual that I'm thinking of, and she's just run with the project, and yeah, it's been amazing. The outcome has been great.
Because I don't work in a clinical role, so have been able to apply it in more performance management or in appraisals, one-to-ones, and actually in conversations that I have with stakeholders, with partners, with residents, and actually out in communities, and it's really helped me rethink the way in which I'm not there to tell people what to do, I'm there to support people in helping them coming up with their own solutions.